everybody, and welcome back to my channel. I hope you're all doing well. I know I recently talked about a training I did at my local hospital for the learning disability nurses and the general practitioners at my local hospital. They recently gave us, the autism service, a feedback form, and on the end of that feedback form they had attached their thoughts and feelings about how the training had gone and what they'd learned and what they would like improved or an added training. And they wrote that they would like an in-depth more session about how to specifically cater to general practitioners, aka GPs. So I thought, as an autistic person, I would do a more in-depth video for you to explain how to communicate with autistic patients who may come into your GP surgeries, who may come into hospital facilities. And these are just things that I wrote down whilst I was responding to the email and looking through the email section to plan this video. So here we go. I hope you learn something from this. This is for general practitioners, aka your medical society GPs, your local community GPs who are going to be interacting with autistic patients on a daily situation. So these are just the thoughts that I had about it. As an autistic woman, I feel it is important to better educate the general practitioners, aka GPs and doctors' surgeries in the local communities and hospitals that you've asked for this information to help support you. So I hope these tips and tricks and advice will help you as your daily work continues with autistic people or suspected autistic people that you may come into communication or close contact with. So I hope you enjoy. Number 1, introduce yourself, showing your name badge and explaining your work uniform. Number 2, give time to process the care treatment plan and why you need to do the treatment that you're doing. Number 3, listen to the autistic person or suspected autistic person of any questions they may have. Number 4, do not ask open-ended questions. Again, this leads to sensory overload, anxiety overload, and sensory shutdown. Please keep the questions direct, aka yes, no answers, so that we can keep in contact with you and communicate with you. Please do not expect full eye contact when you're communicating with someone who may be suspected autistic or confirmed autistic person. Please explain the care treatment plan step by step. So explain everything that you're doing and why it needs to be done and the order that it needs to be done and how important it is, so that the autistic person has a lower sensory overload, lower anxiety or lower depression symptoms. If possible, dim the lighting that's in the room to lower their sensory overload and anxiety. Again, because I know right now you might say, well, you know, Gemma, your light is quite bright. Yes, my light is bright because it's dark in here, but if you're in contact with an autistic person or suspected autistic person, please make sure you turn down the lighting in the room to lower their sensory overload, their anxiety overload. And when you get to meet them, maybe you could ask the autistic person or suspected autistic person about their special interests, whether that's science, geography, math, movies, theatre, Lego, football, anything to do with that kind of stuff. Build up a professional rapport with them so that they trust you and they're likely to communicate with you on the next time round, if it is possible ahead of time. But if not, during the appointment, offer a longer time slot an appointment with them, because 10 minutes is simply not enough, especially if you're autistic on the severe end or you're autistic and you're anxious and you only get 10 minutes with the doctor. This is not enough to talk through our treatment plan, our care needs, and any sensory issues we may be dealing with or panic attack symptoms we may be dealing with. So please offer a longer time slot with the same doctor to lower anxiety episodes. Allow a family member, friend, or professional carer to come with them to lower the anxiety or stress of coming to the medical institution. So if they are an autistic person or suspected autistic person and they're coming to your surgery for the very first time, or to your hospital wing for the very first time, or hospital unit, they may appear to be very anxious. They may not look at you. They may be looking all around. They may want to look down at you. They may look at the mouth. They may look at the nose. They may look at the chin and lip read so they can communicate with you, because they may be very, very anxious ahead of time. So please be aware that they may bring somebody with them and not be on their own. Find out if the patient is already on any form of medication, so whether that's anxiety medications, depressive medications, if they have any other comorbid conditions that may be a trigger to treating them or caring for them. Please find out if they're on any other medication, such as psychoactive medication or psychiatric medications or any herbal alternative medication, so then you can know how to best treat them and their care needs ahead of time. Offer them a fidget and sensory aid to use during the appointment. If they get anxious, they start playing up their fingers, or if you see they, especially a woman, they might play with their hair, or if it's a man, they may pace up and down. So make sure you have sensory aids, sensory fidgets available to your disposal, so then you can give it to them to keep them calm. Also, talk very calm, collected, quiet, because a lot of autistic people do struggle with the way that you speak to them. So again, keep your language very plain, very concise, very timely, concise. Make sure you keep it formal as well, because they will need you to be honest with them and be able to understand them and offer them support along their care treatment, whether that's they're an outpatient in the GP surgeries, or whether they are going to be getting admitted to hospital for a surgical operation or a surgical procedure, or if they need to go into a community unit to get further support. Make sure you know everything you need to know about them as well, because that will help both you and them communicate successfully. Also, if the autistic person or suspected autistic person may have a different language, make sure you have things like language line or alternative communication cards set up, or a speech language therapist or a language interpreter set up, so you can know how to communicate with them and make sure that the appointment goes smoothly and there's no interruptions. So I hope this little video has helped you better understand how to communicate with autistic people, and I will see you on the next one. Bye!